Good morning, everyone. I'm Dr. Kendrick Shih from the University of Hong Kong, and I'll be presenting new technologies and criteria for diagnosis of dry eye disease. And this is a prelude to our Hong Kong dry eye study. Now, we formed a ophthalmic epidemiology group earlier this year, and really the goals are to better understand the extent and scope of chronic ophthalmic conditions in the Hong Kong community, and to elucidate the role of new ophthalmic investigations in classifying and grading ophthalmic conditions, and really to understand the impact of ophthalmic disease on society. What we hope is that with generation of this evidence, that we can better help with policy making in terms of what are some of the important disease in our community that needs addressing. So dry eye disease is a common but underappreciated condition in clinical practices worldwide, especially common in Asian countries with up to 35% of the population quoted as having dry eye disease, and its prevalence increases with age, and it also poses a significant burden on the quality of life. In terms of suffering, it is equivalent to having moderate angina for patients. We can classify dry eye disease into those that are aqueous deficient, those that are excessive in terms of its tear evaporation, and those that are mixed. Now, this is an interesting condition because meibomian gland dysfunction has been noted to be very highly associated with evaporative dry eye disease. And we do see that they have common risk factors such as aging, contact lens use, smartphone, computer use, inflammatory eye conditions such as allergic conjunctivitis and ocular rosacea, graft versus host disease, and Sjogren's syndrome. Now, what we do notice is that meibomian gland dysfunction is when the oil in the glands start to become inspissated, causing inflammation of the eyelids and worsening of the dry eye disease. We do know that now about 80 to 90% of our dry eye patients have coexisting meibomian gland dysfunction, and therefore it's also an important topic to cover now. So we initiated the Hong Kong dry eye study. We started recruitment in September 2021, and we're aiming to have about 120 subjects over the age of 50 per month for the next 2 years. And we're using an active recruitment method so that our methodology is systematic and it avoids bias. Now, what we hope to do is to use non-invasive clinical tools and imaging devices for comprehensive dry eye assessment. And what we hope to do is to determine the prevalence, type, risk factors, and severity of dry eye disease, the prevalence, risk factors, severity of meibomian gland dysfunction, both in the community, and ultimately what we hope to do is find out what are some of the unmet needs and emerging trends. And we can do this because we're collecting data every month as things start to change and as our environment starts to change in terms of the weather, in terms of the pandemic, and things like that. So we can monitor things on a global scale. What we ultimately hope to do is to raise public awareness about dry eye disease and some of the epidemiological information that is important for patient care. We do have some advanced ophthalmic imaging devices and tools, such as the all-in-one dry imaging suite, the Oculus Keratograph 5M, that can assess both the tear film and meibomian glands non-invasively. And we now use the strip meniscometry to measure tear film volume rather than a Schirmer strip. We found that there's a very good association, and the strip meniscometry allows you to do the measurement within 5 seconds rather than taking 5 minutes. So it's especially useful for longitudinal assessment where you have to repeatedly do it to the patient because it doesn't irritate the eye. So what we hope to do is to have a collection of robust data. And so we collect data for dry eye diagnosis in terms of dry eye symptom score, tear breakup time, and ocular surface staining. We collect data on classification, either it's aqueous deficient, evaporative type, or decreased wettability or mixed type. And we can do this by additionally using the strip meniscometry, the tear breakup pattern, which has been propagated by Professor Yokoi, and also assessment of the meibomian glands. We will also stratify our dry eye patients according to severity using this criteria as well. And so thank you for your time, and we look forward to sharing our results on this study in the near future.